In today's video, we'll be discussing the difference between panic attack and panic disorder. Panic attacks are defined by the rapid onset of intense fear, typically peaking within about 10 minutes, with at least 4 of the physical symptoms being written on the board. The most common symptoms accompanying panic attacks are palpitation. Panic disorder, on the other hand, is characterized by episodic or recurrent unexpected experiences of these panic attacks, and they typically occur without a clear trigger. Another requirement for the diagnosis of panic disorder is that the individual worries about further attacks or modifies his or her behavior in dysfunctional ways to avoid these attacks. Panic disorder is typically not diagnosed when symptoms are attributable to another disorder. For example, when panic attacks occur in the presence of a social anxiety disorder in which the attacks are triggered by social situations like public speaking, it cannot be considered a part of panic disorder. Panic disorder is also not a benign disease. It can significantly affect the quality of life of the individual and lead to depression and disability. In addition, these patients are also at higher risk for alcoholism and substance use compared to the general population. In summary, panic attack requires at least 4 of the following symptoms. Whereas panic disorder, the criteria for diagnosis includes experiencing recurrent panic attacks with 1 or more attacks followed by at least 1 month of fear of another panic attack or significant maladaptive behavior related to these panic attacks. Panic disorder is quite common, and according to some studies, it affects about 6 million adults in the US. Women are typically twice as likely as men to develop the condition, and its symptoms usually begin in early adulthood. Panic disorder also has a relatively high lifetime prevalence, ranking behind only social anxiety disorder, post-traumatic stress disorder, and general anxiety disorder. Notably, patients suffering from panic disorder have much higher lifetime rates of cardiovascular, respiratory, and gastrointestinal problems, and also other medical problems compared to the general populations. Panic disorder typically peaks in adolescence and early adulthood with a low prevalence in children below the age of 14. Patients with panic disorders also share many other comorbidities, including OCD, social phobia, asthma, COPD, IBS, which is irritable bowel syndrome, and hypertension. There's been multiple theories and models that exist which speak to the possible causes of panic disorder. Most indicate the potential role of chemical imbalance as a major factor, including abnormalities in GABA, which is a neurotransmitter, as well as hormones such as cortisol and serotonin. It is also believed that environmental factors play a role in the pathogenesis of panic disorder. Several studies have shown that adverse childhood conditions may lead to panic disorder in adulthood, and some newer research also indicates that neural circuitry problems may also have a greater role in panic disorder, whereby certain areas of the brain are hyperexcitable in individuals, and that would make them more prone to develop the disorder. Some studies also show that genetic factors may play a role in the causes of panic disorder, with some studies showing that first-degree relatives have a 40% risk of developing panic disorder if someone in the family already has been diagnosed. In addition, patients with panic disorder also have a higher risk of developing other mental health disorders. Fortunately, panic disorder is a treatable condition. Panic attack immediate interventions include things like reassurance, deep breathing, and relaxation techniques. Panic attacks typically resolve within 30 minutes of onset and may not require acute intervention. But if it becomes episodic and starts to impact the quality of life, psychotherapy and medications are also available for treatment. In summary, panic attacks occur as often as several times per day or as infrequent as only a few attacks per year. There is often not a specific trigger for a panic attack, and patients suffering from these attacks self-perceive a lack of control. Whereas panic disorder is the experience of recurrent panic attacks with 1 or more attacks followed by at least 1 month of fear of another panic attack or significant maladaptive behavior related to these attacks. Panic attacks, however, are not limited to panic disorder. They can occur alongside other anxiety, mood, psychotic, and substance use disorders. Immediate interventions include reassurance, deep breathing, and relaxation techniques. Attacks themselves typically self-resolve within 30 minutes of onset and may require acute intervention, But if it becomes episodic and starts to impact the quality of life, psychotherapy and medications are available for treatment via a licensed healthcare professional. Thank you very much for watching. Hope you have a great day. Bye.